The baby boomers present a unique challenge when we've moved and have a sort of a situation of where we have less nuclear families where multiple generations are not living in the same area. We've got some issues that we're going to have to address about who's going to help take care of grandma when a son or a daughter lives halfway across the country. How are we going to pull this all together so that we look at team-based care? I think here again we've got to look at making sure that the people in that baby boom generation actually provide the absolute best evidence-based medicine care that we possibly can so that people again get the right care at the right place at the right time. One of the things that we know is that the baby boom generation is actually much more active in retirement. There are things that they participate in that years ago we might not have seen somebody that's at that age want to participate in, but their activities are very, very important. So we've got to make sure that we are able to provide them with the appropriate care to maintain that active lifestyle while at the same time taking into consideration long-term care needs and looking at ways that we can provide them outside of traditional models, which might have included an inpatient care stay, but look at more things like how do we do more home and community-based services for that generation.
Nobody likes to talk about it, but is rationing an inevitable product of the future when it comes to this?
I would say that rationing is really not going to be necessary. I think what we've got to do is make sure that the care that we give to people is care that they really need. Now, some people may choose to call that rationing, but then that becomes a burden on the healthcare system to really provide education about what do you need as appropriate care and make sure that we spread those resources out to make sure that people get the right care at the right time. So one of the key tenets of Magnolia's philosophy is being very active in our local communities to improve the lives of our members. We do several things to really reach out to our membership and to support those that we serve. Three things really come to mind right off the top of my head, and one of those is that we participate in the and are actually one of the big sponsors of the U.S. Department of Agriculture Summer Food Program. So for children who live in areas where they may be at home by themselves throughout the day and don't have access to a nutritious meal like they would during the school year, we actually work to provide meals through this program during the summer months. Last summer, Magnolia worked with the Department of Agriculture and provided over 2 million meals during the summer to children throughout the state of Mississippi. The other thing that we do is sponsor activities, particularly things like the Challenger League and their sports programs that we are active in. We sponsor runs throughout the state or participate in runs and are very much part of the community that way. And finally, I couldn't talk about things we do in the community without talking about our baby showers. For those members that we take care of, we actually conduct a baby shower where the first part of it, and we use the term baby shower a little loosely here, the first part of it is really on how do you have a healthy pregnancy? What do you need to do to take care of yourself? And then the second part of the baby shower is really on how do you take care of a newborn infant to make sure if that infant has a health need, you appropriately address that health need. And then in the course of that, we do some educational games to instruct them so that it's really a learning opportunity for our members.